There was a very fascinating study published where they sleep deprived people for 21 hours. And of course, when you sleep deprive people, as pretty much anyone knows, their scores of attention went down. They performed more poorly on all these cognitive tests. They gave them this massive dose of creatine that wasn't really studied before. And a lot of their cognitive markers, their testing, came back to their baseline. In some cases, it actually even improved, even after being sleep deprived for 21 hours. They sleep deprived mice, and then they gave them nicotine to see what would happen, where they were just measuring levels of chemicals in the brain, BDNF, which a lot of people call miracle crow for the brain, helps improve neurogenesis, dropped quite significantly with sleep deprivation, 24, 36 hours. They gave these mice nicotine, and it actually improved quite a bit. So then the next logical study was they took mice, they sleep deprived them for 48 hours, I believe. And then they gave them all sorts of tests. They're making several mistakes. I think they were making up to 4 near the end. But they gave them nicotine, and they reverted almost back to normal. All the learning deficits caused by sleep deprivation were reversed. Instead of long-term memory this time, they looked at attention. And they wanted to compare binaural beats to, of course, placebo, but also people that practiced mindfulness. What they did is they had a group listen to binaural beats and then do an attention test 5 times in a row. They wanted to exhaust them to see how much their attention would drop. The people who were experienced in mindfulness, who had been doing a month of meditation, scored about 75% the first round, and it dropped to maybe 60%. The people who were in the control group got about 50% right at the beginning. After exhaustion, they were only 20%.
That's a big drop.
It's a huge drop, huge. Just adding binaural beats, right? Something very easy to put on your ears, takes no time. The group went from, again, about 50% before starting, and they increased to about 54% at the end of the task. So not only did they not drop 30%, they actually improved a little bit despite this exhausting task that they were doing beforehand.
Which is an effect that you never see. Like not just dropping, but improving when you've got some sort of stressor. That's amazing. If you've been paying attention to the world of biohacking, fitness, or even late night study hacks, you've probably noticed that 3 things keep popping up: creatine, nicotine, and something called binaural beats. But why is everyone so suddenly interested in these, and what does the science really say? Today, we're diving into a fascinating conversation with Dr. Brandon Liu, an internal medicine trained doctor currently specializing in respirology, who's been through the grueling 26-hour shifts of residency and has experimented with some cutting-edge, evidence-based protocols to boost performance under extreme conditions. Let's start with creatine. You might know it as a popular supplement at the gym, but the truth is far more fascinating. Creatine is a natural molecule your body actually makes on its own. Think of it like a hybrid car's hidden battery pack. It stores quick energy and recharges your cell's main fuel, ATP, helping muscles and brains push a bit harder when they need to. At the gym, that can mean an extra rep or 2, but what about at your desk or during a brutal overnight shift at the hospital? Some new research and Dr. Liu's own experiments suggest creatine might boost mental performance too, especially when you're sleep deprived. Of course, not everyone's convinced. Is creatine a harmless supplement or a risk to your kidneys? Does it really make you smarter, or is that all hype? And why are more and more vegetarians and vegans being told to consider it? Then there's nicotine. Yes, the nicotine, the same chemical that hooks millions on cigarettes. But here's the twist. Some researchers and sleep-deprived residents like Dr. Liu are exploring whether tiny, controlled doses, think gum or mints, not smoking, could actually sharpen focus and attention without the deadly risks of smoking. But can you separate the poison from the performance boost, or is that just wishful thinking? And finally, binaural beats, these strange pulsing audio tones that claim to hack your brainwaves by tricking your mind into new patterns through what researchers call brain entrainment. Programmers swear by them, students stream them for hours, and new studies hint they might really boost memory and focus if you know how to use them right. In today's conversation with Dr. Brandon Liu, we're pulling back the curtain on what's real, what's risky, and what's just hype. By the end of this video, you'll understand why everyone's talking about creatine, nicotine, and binaural beats, and whether they deserve a place in your routine or not. Join me in Vivo with Dr. Brandon Liu on the brain-boosting trio, creatine, nicotine, and binaural beats. Dr. Brandon Liu, thank you so much for joining me.
Happy to be here.
I think before we get started, it would probably be appropriate to put out a bit of a disclaimer.
Yeah.
You are a doctor, internal medicine doctor. You're going to be working on some other specialties soon. We'll talk about that. We're going to talk about creatine, nicotine, some study habits, binaural beats, that sort of thing. You had a very interesting experience with your residency, 26-hour shifts. We'll talk about what worked for you, what didn't work for you. That being said, speak to your own doctor. Even though you're a doctor, speak to your doctor about anything here we talk about today. And we're going to talk about Brandon's, your interesting story of how you sort of experimented on yourself. Some protocols, evidence-based protocols. So welcome.
Thank you.
Why don't we, I think it'd be wise to start off with creatine because it's a very popular point of discussion amongst health enthusiasts, gym bros, of course.
Exactly.
People interested in optimizing their cognitive health and especially sleep deprivation, which is what you sort of are starting to specialize in. What is creatine?
Creatine is essentially it's a molecule that our bodies make on its own that a lot of people have been supplementing with recently. And the reason that we've found a lot of benefit with it is that it seems to kind of work as a backup energy system. So one analogy I really like is kind of like driving a hybrid car, right? So it's in your best interest to use the electric part for as much as possible before you start using the gas.
Yes.
And a good analogy for creatine is, it's strongly associated with people like using it at the gym to get stronger. And the way I like to think about it is it allows you to use a little bit more of that electric part of your car. It's a bit of a backup energy system, if you will. So I guess moving a little bit back into physiology, not to belabor it too much, but if the mitochondria is the powerhouse of the cell, which many people are familiar with, ATP is the energy currency of the cell.
Yes.
And so what creatine is able to do is it's actually able to donate a phosphate group to ATP that's been used. ATP is essentially the best cellular source of fuel. It's in our best interest to keep using it because otherwise, after aerobic metabolism, we start going into anaerobic and we start developing lactate, which is kind of like going into the gas part of your hybrid car. So ATP will get used up and become ADP, adenosine diphosphate from adenosine triphosphate. So 3 phosphates to 2. And creatine's able to rapidly donate a phosphate group to that ADP.
To regenerate the ATP, your store of ATP.
Exactly.
Right.
So where that becomes helpful is at the gym, it allows people to squeeze out probably one extra rep. And that adds up over time, where if you're doing slightly more exercise, running a little bit further, lifting a little bit more weight, it actually leads to, over time, quite significant impacts. And we know, looking at the original literature for gaining muscle strength, people that use creatine can see like almost double the gains in strength. And especially beginners, you can see up to 30% improvement in strength in some trials versus maybe 15% people not taking creatine. So you get that huge benefit by just a little bit of extra work that you're able to do.
Right. Push through it a little bit more.
Exactly.
So since we're talking about strength, silly question, but is creatine a steroid? In terms of in the gym, is this something that's going to get you in trouble? Is it banned by sports? Is it considered a performance enhancer?
That's a great question. A lot of people think that creatine is, an anabolic steroid that's going to cause hair loss, renal failure.
Yeah.
What I'll say is, the International Society of Sports Nutrition recently put out a very good piece on the safety and utility of creatine. And they looked at all the studies, and people were taking up to 30 grams of creatine for years, and there were no significant adverse effects reported. We have recent trials showing that it doesn't seem to be causing hair loss, so people can be a bit at ease about that. It's, as far as I'm aware, not banned by any societies. And one concern is kidney impact, because, you know, in day-to-day medicine, when a doctor wants to check someone's kidney function, how well they're working, we look at a molecule called creatinine, which is a breakdown of muscle products. And sometimes when, you know, really big bodybuilders come in and get lab work done, their creatinine is very high.
Right.
And people might look at that and think these people are in renal failure. But it's actually just they have significant muscle mass.
Right. And have been supplementing most likely with creatine. Exactly.
So sometimes creatine can fictitiously increase that creatinine. I would say that it's generally very safe and well tolerated. If you have kidney disease, I would certainly talk to your kidney doctor before taking creatine.
Yeah.
But by and far, it's very well studied and it's been very well tolerated. And personally, I feel very comfortable taking, up to 10 grams a day.
Okay. Well, speaking of which, it probably would be,
let's do it.
Hypocritical if we didn't. We're going to talk about the help yourself, the cognitive benefits and the benefits in terms of sleep deprivation. So obviously, we're not at the gym right now.
Exactly.
And people do report having some significant positive effects, which we'll talk about there. You're putting that in water.
Yeah.
I'm putting mine in coffee. Is there hot coffee and cold water? Is there any reason why you should not put it in hot coffee?
That's a good question. I've looked into that before. I didn't find anything compelling to tell me that hot coffee is going to break down your creatine. I think water's, it's generally like the most studied way, but it's probably fine to have in coffee. There was a bit of concern about creatine and caffeine, like caffeine interfering with the absorption of it.
Interesting.
I think that only happens with very high doses. So with a coffee, or you're drinking a morning coffee, cheers. Delicious.
Love it.
I would have no concerns with taking caffeine with creatine.
And I guess we should, little caveat. What we are consuming here is creatine monohydrate. These guys are not a sponsor, but these guys are great. You can get them at Costco, and it's very cheap.
This is the exact same one I use.
Wonderful.
Just get the cheapest one you can
find.
The
cheapest one you can find, as long as it's pure, and most of them are. It's a great brand, Lean Fit. Creatine monohydrate. You can also find and purchase creatine hydrochloride, HCl. But by far, creatine monohydrate is the one that most people supplement with. So you mentioned earlier that the human body does make creatine, about 1.5 grams a day. Outside of the body, you can find it in mostly meats at pretty low quantities. We're talking about 0.45 grams per 100 grams of chicken, beef, fish, that sort of thing. How much creatine do you need?
That's a good question.
Let's say as an omnivore. We can talk about vegetarians in a second.
That's a good question. I would say it depends what you want from it. When we look at some studies of dietary creatine, there does seem to be some correlation between higher dietary creatine and potentially lower incidence of cognitive disease. Generally, the maintenance dose that's recommended is 5 grams of supplemental a day if you want to improve muscle strength, improve brain function.
Which is what we just had.
Exactly, 5 grams. Recently, there's been some data that suggests that for the brain, a higher dose is actually better.
Yes.
The one study I think most people look at, it was young women, and they gave them 2 grams of creatine, 4 grams, and 10 grams. And then they quantified how much it increased brain creatine levels.
Right.
So 2 and 4 grams increased creatine in the frontal lobe by about, I want to say 4 to 5%. But 10 grams was almost double that. It was about 9% increase.
Right. So there's a dose, not dependency, but there's an effect. Yeah.
Exactly.
Compound effect. Yeah.
Exactly. So given that, a lot of people have started recommending 10 grams for improved cognition. That's what I've been taking in the context of a lot of sleep deprivation with my residency, for example. I think there's a lot of interesting trials coming out. We're going to get a much better sense of how much creatine you really should be taking for maximum cognitive or physical benefits.
So in order to hit those quantities, 5, 10, 15, 20 grams of creatine, that's a lot of meat to be consuming.
Yeah.
Right. So if we're considering 0.45 grams per 100 grams of chicken, you're talking about 10,000 grams of chicken to get about 4.5 grams. So quite a bit. So supplementing is probably a good way to go. Now, what about, vegetarians, vegans? They have a tough time with protein. They can get that from other sources, plant protein, tofu, beans, that sort of thing. But creatine is tough. If you were a vegetarian, would you be supplementing with creatine?
Definitely.
Yeah.
Again, the evidence base, to be fair, is not fantastic. I think it'd be great to randomize vegans, vegetarians, give them high doses of creatine and measure all sorts of physical and cognitive function. There's a little bit of data that vegetarians do actually get some cognitive benefit from adding creatine. Again, it's one of those things where it's about risk and benefit to me. There are a few things that seem to have as impressive an evidence base for at least improving muscle strength and now more recently improving cognition with very minimal side effects. Some people get a bit nauseous, notice some bloating initially, so I'd certainly start low and titrate up. But if I were a vegetarian or vegan, this isn't medical advice. Certainly talk to your doctor if you have medical issues, but in otherwise healthy people, I think it'd be quite reasonable to supplement 5 grams a day.
Now, we opened by talking about ATP, mitochondria as being the powerhouse of the cell, which is what I think every biology student hears, and that's how they know the mitochondria. What's important to note, if we're going to talk about cognition, sleep deprivation, is that the brain consumes about 20% of the body's energy. So that is sort of, I don't want to say a reason to, but it's something to keep in mind when you're talking about, hey, ATP is a source of energy. I can replenish my store of ATP by providing sources of phosphate through creatine. Now, tell us a little bit about this crazy journey, this training that you've gone through recently as a resident, because I don't think, definitely some people appreciate what it takes, but when you sit down and you think that, about these 26-hour shifts that you went through, and then I want to mention that you document really well on your X page at Brandon Liu, MD, fantastic X page for evidence-based protocols, not just creatine, not just some of the other stuff that we're going to talk about, but really sort of documenting your journey through that academic training and talking about what helped, what didn't help. Right. So tell us a little bit about what it takes to become an internal medicine doctor.
I would love to.
Please.
It's been a whirlwind.
Yeah.
I grew up just as a bit of background in Thunder Bay, so that's in northwestern Ontario. Catchment area is about 100,000, 150,000. I traveled all throughout northern Ontario on very small hospitals, seeing a lot of really cool rural medicine care. But I wanted to see what the big city was like. So I decided to apply to internal medicine at the University of Toronto, biggest center in Canada, matched, and really, didn't really know what to expect. And so I'll never forget my first day. I was assigned a 26-hour shift. And I remember, it was the most stressful day. I was on cardiology. People were sick. I couldn't figure out the EMR system. And everyone started, packing their bags, getting ready to leave at 5 p.m. And it kind of hit me like, I'm not even a third of the way through my shift. And I remember covering a ward of, many patients. I was admitting a lot of sick people overnight. And this was, no one prepared me for this, right? It's one of those things where you just do it because everyone else does.
Mm-hmm.
And I remember it was like 2 or 3 a.m. in the morning. I was typing up a note, and all of a sudden I just remember like my head hitting my keyboard from falling asleep and just thinking like, how am I going to do this?
What's wild is that you're expected to make life and death decisions at times.
Yeah. There are backup systems. There are people to call in certain circumstances. But it's residents in the hospital that are very sleep deprived, right? So it's there's been a lot of ongoing research recently into are these 26-hour shifts that safe for people to be taking care of patients? What I will say is a bit interestingly is it actually seems to be, at least in some trials, equivalent to doing 12-hour overnight shifts. And that's because of handover. So, this first day of cardiology, I got to know probably 10, 20 patients that were admitted to the ward, learning all about their history, examining them, talking to them. So that if I was called about someone having chest pain, like I knew this person, right? I looked them in the eye earlier that day. I assessed them. I knew they had a history of, whatever, valvular disease or cardiac history. And even though I was sleep deprived, I knew them better.
Right.
And so the concern is that if I were to hand off to someone at 5 o'clock and gave them a 15-minute rundown of everyone on the list, them not being so exhausted or sleep deprived, but not knowing them seems to actually balance that out.
Interesting.
So it's actually becoming one of those things where I actually don't think these 26-hour shifts are going to go anywhere anytime soon.
Well, that was my next question. Do all, Western countries follow the same sort of protocol?
It varies quite a bit. A lot of programs will do more recently a night float system.
Okay.
Where you just work overnight, like shift work, like any other job that's a shift work kind of thing. In Canada, it's actually, there's a lot more 26-hour shifts, I think, than actually compared to colleagues that I've spoken to from Europe or other countries. Surgical like residents, they do work quite a bit. They'll even stay in the hospital for up to 36 hours at a time.
Right.
So I would say actually a lot of places are moving away from this 24, 26-hour model, but it's complicated.
So what point in your residency, this sort of boot camp of medical training, did you realize I got to do something in terms of trying, for example, creatine? We'll talk about other things in a second.
Yeah. After the first night, to be honest,
yeah.
I was so exhausted, and I will say it got better over time. It became a lot easier. The job is very humbling, and I'm always surprised by things every night, but at least staying awake got a little bit easier. But I just was shocked at the fact that there's, no guidance for, here's how to stay healthier during all this. Here's how to keep up your cognition, because people's lives really are on the line. And I was doing those, 26-hour shifts on average every four days, like up to 7, 8 times a month.
That's amazing. With no, like you said, training or even a warning of what you're about to experience.
Exactly.
Right?
Exactly.
Now, since we're sort of on the topic of nutrition, because I don't, wouldn't say is it a myth or poorly understood amongst lay people, but how much training do doctors in Canada at least receive in the area of nutrition?
That's a good question.
How much did you receive?
I actually can't think of any nutrition training I've received.
Interesting.
Perhaps a lecture in medical school.
Right. This is what I think people hear anecdotally from doctors.
Yeah, that's a good question. Very minimal.
That's interesting. Obviously there's a trend. There's a change in the way that people are. The fact that we're having this conversation about creatine and nutrition, people are more interested. So maybe we'll see that in the future.
Yeah, certainly. Around certain diseases, we get some training about benefit there. But yeah, I there's a lot of American politics about
Sure.
Schools being forced to put nutrition into their degrees now, which is, I think a little more education might be helpful, but it's actually the field's very much a moving target.
Mm-hmm.
And it's
the field
of nutrition. Yeah. And it's very controversial with what diets are better, or what's healthier.
That's true.
And at least for me, I think what was more important was getting the tools of being able to look at research critically and do my own kind of looking into things.
Right.
I found that more valuable. Maybe we should have a little more education, but I think, doctors, if we equip them with the right tools, should be able to keep up with the literature themselves.
So back to creatine and your experience, what did you find helped the best in terms of protocols? Because there are many out there, and on your X page, you outline 3 different protocols, and you've labeled them as creatine kickstart, consistent creatine, or protocols timing it right. 3 different protocols. They're very different, and one might be right for you. What did you find worked best for you?
Yeah, I've experimented a lot, and this all came from me not wanting to suffer through sleep deprivation, not wanting to make, silly mistakes that could have been avoided, and wanting to find something that would help a little bit. And so looking at the studies, 10 grams of creatine a day seems to lead to quite a significant improvement in brain creatine levels. So I've been sticking at 10 grams a day. But there was a very fascinating study published where they sleep deprived people for 21 hours. Mm-hmm. And they gave them, let's say, a bolus of creatine, a quite massive dose. I think it was 0.35 grams per kilogram.
Yes, I believe we'll put that up on the screen right now.
So for me, that would be about 30 grams, right? So 6 of those scoops.
Yes.
Which, what I will say is, I think they saw the max effect at 4 hours. And of course, when you sleep deprive people, as pretty much anyone knows, their scores of attention went down. They gave them a battery of cognitive tests.
That's 4 hours of sleep?
4 hours after taking the dose, they seem to have the most significant improvement.
Yes.
But there was still improvement at 21 hours. So they performed more poorly on all these cognitive tests. They gave them this massive dose of creatine that wasn't really studied before. And a lot of their cognitive markers, their testing, came back to their baseline. In some cases, it actually even improved, even after being sleep deprived for 21 hours. So I experimented with that, of course. I still haven't, I've thought a bit about it. If I'm taking 10 grams a day, presumably I have a good saturation or store of creatine.
Right.
So I don't take 30 grams the night before. I'll take 10 grams every day, and then I'll take maybe 5 to 10 more that night that I'm, not sleeping.
Right. You mentioned saturation, which is sort of the thing that, pardon the term, the gym bros used to talk about is loading, right? Yeah. Is to get to a certain saturation of creatine in your system. You load with large amounts for a couple of days, but the point is, the research shows that you'll eventually get there, whether you're doing that with a large bolus in a short period of time or smaller over a longer period of time. Eventually, you'll get there. So if you are concerned with these higher numbers, you'll get there eventually. Now, I guess, this brings up the question, when should you take it? Does it matter when you take it throughout the day in terms of the 24-hour clock? Or that's one question. The other question would be, when should you take it in context of the work that you're doing or when the sleep deprivation is happening? So what would be the optimal time to take it?
Based on that one study, if you want to time it right,
yes,
you should, you could take the dose probably right before your shift starts. Pragmatically, what I would say is, in medicine, it's very hard for people to remember to take their medications.
Sure.
I even forget to take my creatine, some days.
Yes.
So I think what's most important is just doing something that works for you. Right. A morning ritual, you get your coffee, I have my creatine at the same time. Sometimes I forget to take it in the morning, but very rarely now that I kind of have established a routine. And then at least if I forget to bring my creatine to work, I've still had my morning dose.
Right.
So I would say the most important thing is just finding a routine that works for you.
Is there anybody who should not be taking creatine?
I would say that if you have pre-existing medical conditions, kidney disease, definitely check with your doctor first. But for people relatively healthy without any medical issues, it's probably going to be very safe and well tolerated.
Now, this might seem bizarre to some people, but is it safe for children to take?
That's a good question. I know that there has been a lot of work into that recently, and looking into that question. I don't, to be honest, I don't feel qualified to comment on that.
Yeah, that's fair.
I haven't done a very deep dive for kids. I probably wouldn't at this point, but I'd have to do a bit more of a deep dive in the literature. And I usually, I'm an adult medicine doctor. I try to stay away from anything kid related.
World altogether.
Yeah.
Well, fair enough. Do you need to cycle creatine? Do you need to come off creatine at any point, or is it something you can take for the rest of your life?
That's a really good question. That was the classic gym teaching.
Right.
The thought was give your body a bit of a rest. And then when you cycle back on, you time an exercise program to get the most benefit. Right. So I think it's fine too if people want to. And I've cycled a bit. And what I do really like is that once you restart it, you actually note, like at the gym, like you notice a really big difference. And I'm at the point now where I'm comfortable enough with the data where I just take it every day. I don't cycle anymore. I'm relatively confident that's going to be safe for me. Again, there's always a small risk with these things. So you might want to check with your doctor if you're going to take it for years and years. But I don't really feel the need to cycle based on the literature anymore.
Now, what about the fact that you might become resistant to creatine intake? Because it's well known that creatine gets into the system via CT1, which is creatine transporter 1, is a protein that resides in cells, draws creatine into the cell so the cell can use it to replenish that ATP source. Taking exogenous creatine via supplementation does cause downregulation of that protein.
Yeah.
Right. So therefore, you might need to take higher doses eventually. What are your thoughts on that?
Yeah, I have heard of that. That's very interesting, right?
Mm-hmm.
And certainly, if you're going to take a high dose of creatine for many, many years, is a concern, right? We certainly just need more research into that.
Right.
What I would say is, I feel like currently the benefits of taking creatine daily outweigh the risks of developing some resistance. And if I have to take a bit of a higher dose down the road from a little bit of downregulation of the receptors, I'm okay with that. But this is one of those things where, we're learning so much, every day with new studies, and we just need more research into the field.
There was a really interesting study that you published in regards to maintaining muscle mass during immobilization or during injury.
Yeah.
Tell us a bit about that if you can recall the numbers. If not, I got them here.
Yeah, I don't remember the numbers exactly.
So the study said that muscle mass, so when you immobilize an elbow, for example, so it was a study looking at, I think it was artificial immobilization.
They casted, healthy people.
In cast, and they saw a 20 to 32% decrease in muscle mass, which is enormous.
Yeah.
You see that when somebody breaks their arm, they take off their cast and, half the size of the other one, essentially. But with creatine, it was less than 5%.
Yeah.
So, that says a lot in terms of, it's a totally different sphere of benefit, is maintaining muscle mass during an injury.
Yes. And that's something that you don't really hear talked about very much.
I had not heard about that until I saw you post about it.
I posted about it because I can't remember the exact, I think my friend tore their ACL and they texted me and they asked, like, what can I do to preserve my muscle mass? So I just started, looking for literature on that. And then I found this creatine study that no one's ever talked about that showed these fantastic results, right?
Right.
I think that has a lot of profound implications. You hospitalize people and they rapidly lose muscle mass every single day. We should consider doing a trial on that.
Do they ever, in your experience, give patients creatine in the hospital?
Never. No,
Never.
no.
Not even a thought, eh?
No, that'll take a while to break through, I think.
Could you? Let's say you as a doctor.
Could I prescribe it? I don't. If I wrote it, if I wrote it on a patient's chart, that'd be a fun experiment to see what pharmacy would say. I think the issue is pharmacy doesn't stock it.
Right.
So I guess, let's say I were hospitalized for, tearing my ACL, or I was going to be there for a while. I would probably just bring in my own.
Right.
But there is one study, they gave creatine to patients with advanced lung disease during rehabilitation.
Interesting.
And they did show a significant improvement in several markers, I think quality of life and how far they were able to walk. So there is some evidence there. And again, risk versus benefit, pretty relatively harmless compared to a lot of the drugs we give on a regular basis. So I would consider recommending it to older people with deconditioning. If I were in the hospital, I would want to keep taking it.
So let's look at a little bit more on the cognitive side. And, when you're talking about a situation, it's always good to look at it from two perspectives. Low brain creatine accompanies many severe neurological conditions. So we see low creatine in some neurodegenerative disorders, and it correlates with severity often. So that may show you that there is some sort of connection between creatine and cognitive performance. What do you have to say about that?
Yeah, I think there's some really interesting research coming out in that field.
But not all of them, right? Right? Is it Parkinson's, not Parkinson's, but muscular dystrophy? Yeah, correlated with muscular dystrophy, but not Parkinson's. So obviously very different conditions.
Yeah. And I think it's a bit early to comment on if giving creatine helps. There's a little bit of, I think, mechanistic evidence. What I will say though is, with respect to improving brain energy stores, creatine, it makes a lot of physiologic sense.
Right.
And I guess maybe one study to touch on briefly when we talk about creatine in the brain and reduced energy is a very cool study where they deprived people of oxygen. They took, I think it was a group of healthy young men, and they put a mask on them and they gave them 11% inspired oxygen.
Wow.
Atmospheric is 21.
Right.
And then for 90 minutes, made them do a bunch of cognitive tests. And you could see quite beautifully their oxygen saturation dropped quite quite low.
Right, as you'd expect. Yeah.
They were truly hypoxic. And what they did is they loaded one group with creatine. They did a load for a week, and they gave another group placebo. And as you can expect, the placebo group, their attention dropped, I think, 30-40% on the tests they were doing. Other cognitive tests were doing quite poorly. But loading with creatine actually brought a lot of those almost back to baseline for that full 90 minutes, which goes to show, I think, where a lot of the benefit with creatine is when you're just about to exhaust your energy stores.
Right.
Because ATP, it's the best fuel we have. It's the most efficient, but it's slow to regenerate.
Yes.
So that goes to show that 90-minute period, starving these people of oxygen, very low oxygen. I'm surprised they even got ethics to do this study, but I'm very happy. It's a beautiful study. In those cases, creatine has massive benefits. Could it translate to benefits in people with mitochondrial dysfunction? Potentially. I think it's a really interesting area that we need to further explore.
Interesting. And sort of the last thing we can, it's great for concussion recovery.
Yeah.
There are some correlations with improving mood disorders, especially with sort of flipping on its head the SSRI sort of theory of depression disorders is sort of in doubt now. Serotonin theory, if you can call it that. that might be a discussion for another day. But another thing that personally interests me is the effects of creatine on diabetics. So, I myself, I'm a type 1 diabetic. There are, 0.8% of the population in Canada, at least in Canada, is type 1 diabetic. 8% is type 2 diabetic. So we're talking about almost 4 million people in total. But what we see with creatine is a 1.1% drop of A1C with creatine. And so A1C is sort of your 3-month average of blood sugar. You want to keep that as low as possible as a type 1 diabetic. And ultimately, these studies show that it's 15% greater effect than glucose, or there's a 15% greater reduction than without creatine, essentially, at the end of the day. So we talk about mood disorder, we've talked about muscle mass, we've talked about cognitive performance, and now we're talking about blood sugar levels. So it's not my point here is that creatine, it's not a panacea. It's not a one solution fits all, but there are some benefits here beyond what the gym bros would have proposed years ago.
Exactly.
It's very interesting. I've lost my train of thought. What was I going to say about diabetes? And sleep deprivation. All that being said, though, in terms of sleep deprivation, I'm sure you would agree there's nothing better than a good night's sleep, right? Don't go depriving yourself of sleep.
Exactly.
Thinking that creatine is going to fix that. If you're a truck driver and you need to focus on the road, don't skip out on your nap.
Exactly.
Right?
Please do not stop sleeping.
So just that caveat.
Yeah.
Right. Okay. So you looked at creatine, which I think is becoming much more accepted in terms of not just working out at the gym, but you also did a deep dive into nicotine.
Yes.
Which is far more controversial for obvious reasons. What did you come out learning about nicotine after your experience in residency?
Yeah, this was, something I just stumbled upon in the literature. I wanted to find all sorts of ways that I can improve cognition, learning, attention while sleep deprived. I didn't want to take stimulants. What I'll say is exercise is probably the best thing you can do under sleep deprived states.
Yeah.
Nicotine, I stumbled across a few very interesting studies, and it's more recently been talked about in its non-smoked forms.
Yes.
So just as a caveat, no one should ever smoke any form of nicotine. Don't vape, don't smoke cigarettes, nothing. I'm talking about patch or gum.
Right.
So I found a few...
Ladies. As an example.
Yes, exactly. So...
Careful.
Sure. Yeah.
Pomegranate, mint?
I'll do mint.
Oh, I'll do pomegranate.
How many 4 milligrams. Wow. That's I have 2 milligrams. I'm going to take... Yeah. Oh, do they? You can Yeah, let's do that.
Yeah. Right. So that's something we'll talk about too. So these are 4 milligrams of nicotine. Might be too much for some people. Not enough for some people.
Yeah.
Right. So don't vape, don't smoke.
Don't vape, don't smoke.
Don't pass anything through your lungs as a respirologist.
Exactly.
Right.
So we know from, recent meta-analyses and looking at, a lot of small studies that nicotine is a stimulant. There's nicotinic acetylcholine receptors all throughout the brain. Probably the reason smokers, have a really hard time quitting and love smoking is because, nicotine binds to these receptors and triggers a cascade of these neurochemicals.
Excitatory effects.
Exactly. Dopamine, serotonin,
GABA,
norepinephrine.
Yeah.
And, a lot of people have been talking, on social media about how it's cognitively enhancing.
Yes. And
so when you look at the meta-analyses, there does seem to be a bit of a consistent effect on improving attention. And when you dive a little bit deeper with respect to sleep deprivation, we don't have any human studies, right? So this was just something I experimented on my own based on mechanistic data and animal studies. Mm-hmm. So knowing that nicotine is a bit cognitively enhancing, seems to improve attention, some researchers did a few studies on some mice where they sleep deprived mice and then they gave them nicotine to see what would happen. In one study, it was a study where they were just measuring levels of chemicals in the brain, BDNF, which a lot of people call miracle crow for the brain, helps improve neurogenesis, supports neurons. Dropped quite significantly with sleep deprivation, 24, 36 hours. They gave these mice nicotine and it actually improved quite a bit. So then the next logical study was they took mice, they sleep deprived them for 48 hours, I believe. And then they gave them all sorts of tests. Or it was a maze test where they were testing how fast mice learn and how many mistakes they were making. Sleep deprive these mice for 48 hours. They're making several mistakes. I think they were making up to 4 on near the end. But they gave them nicotine and they reverted almost back to normal. All the learning deficits caused by sleep deprivation were reversed. And I thought that was really fascinating. And then I found a quite detailed but beautifully written mechanistic review talking about all the potential mechanisms that nicotine could reverse the negative effects of sleep deprivation. I'm not a neuroscientist. I don't understand all of the receptors, but it was a very well written piece. And those studies altogether, I weighed the risks and benefits. Definitely did not want to smoke it, but I started taking small doses, 2 milligrams, occasionally overnight, and my own experience
as you're working,
as I'm working.
Shift, right?
Yeah.
Not while you're sleeping.
No. 2 a.m., I'm exhausted.
Yeah.
Take 2 milligrams of nicotine. And, this is probably potentially a lot of placebo, but what I will say is my fatigue just melted away in a lot of circumstances. It was quite fantastic.
Had you ever smoked before?
No,
Okay.
never. A couple of cigars, I guess, as a university and stuff, but
of course.
No regular nicotine. And, to be honest, I'm I have a respect and a fear for nicotine, right? I see people that smoke every day that cannot stop smoking, no matter what they do, how habits they change, medications they try. Very habit forming.
So is it so this is sort of a controversial question, or an important question is nicotine itself addictive?
Yes.
It is. It is addictive. In addition to all the other stuff that they put into cigarettes or into vapes, it doesn't make it any better. But nicotine itself is addictive.
Yes.
Okay.
At least there's a very strong risk of it.
Right.
So, I would say I have a respect for it. I don't do it every day. I do it occasionally. I'll do, the lowest possible dose, like 2 milligram gum when I need it.
Right.
2-3 times a week, max. But I notice overnight, I get a really big boost in, attention, even recovering from 26-hour calls, sleeping for a few hours, waking up, needing to get some work done, and taking a bit, I feel quite a lot better. It's quite substantial. So
nicotine is considered a nootropic. This is a term that gets tossed around, I think, a little too loosely. Can you define that for us?
Essentially, I think most people consider nootropics any chemical that you take that seems to improve some domain of cognition.
Right.
So with respect to nicotine, we've seen a lot of trials, a consistent effect in improving attention, at least.
Is there anybody who should not be taking nicotine? We'll talk about in terms of gum or mints.
Yeah. Nicotine, it's at the point now where I wouldn't recommend anyone, start taking nicotine based off the studies, right? This is something that I wanted to experiment with to see how I felt. And this is just my experience I'm talking about. There are concerns with, it's a stimulant, right? You get a bit of release of norepinephrine, adrenaline, right? If I inject someone with adrenaline, their heart rate's going to go up, their blood pressure is going to go up. So definitely, if you have high blood pressure, stay away from nicotine. Addictive personalities.
Sure.
I do wonder, a lot of people are vaping a lot. And actually, it was funny because a lot of my surgical colleagues overnight were telling me that they vape because they notice that it really wakes them up and keeps them going.
Right.
I've tried to convince them to use gum instead. but it's one of those things where it is highly addictive. So I wouldn't say anyone should take it. It's one of those things, if you're going to experiment with it, if you have medical issues, certainly talk to your doctor. But with everything we do, there's a risk, right? I've tolerated it quite well. I've noticed a lot of benefits, but that's just me. And I don't feel comfortable enough speaking to how other people will do, because there's not really much literature on it.
Right. So you're pretty public with what you've been doing. You beautifully outline it and sort of archive it on your X page. What do your colleagues, your fellow students think about what you're doing?
I would say half of them find it very interesting.
Yeah.
Right. Because, this is how we advance science.
Right.
Right. You walk into residency, you're supposed to stay awake for 26, 30 hours and just suck it up. Right. And I think we really need to change the tide and be more inquisitive. What can we do to make ourselves, smarter, learn more, be able to, make less mistakes? And a lot of them find it pretty interesting, actually. I've convinced a lot of friends to start taking creatine, especially for overnight shifts. Nicotine, it's very demonized, right? Everyone thinks of smoking, everyone thinks of cancer. So, it's one of those things I don't really recommend to other people or colleagues, but they do find the science quite fascinating. And, my hope is that we can start to do bigger trials on it. I would love to see a trial of nicotine in sleep-deprived adults.
What is interesting is that tides changed so many times. I mean, there was a time when doctors would prescribe or suggest Marlboros.
Yeah.
That obviously went away for good reason.
Exactly.
We might see a time where nicotine becomes a little bit more, it's becoming more accepted for sure. But in terms of the medical world. Something else that you talk about, which is stepping away from nutrition, if you can call nicotine, at least things that you consume through your mouth.
Yeah.
Binaural beats. This is fascinating. Now, this is something that I've experimented with and anecdotally can say, and I still do. I use it when I study or if I'm writing, coming up with lectures and that sort of thing. Very different than what we just talked about. But tell us about binaural beats, because I think that it's very well known among certain people, computer programmers, people who sit in front of the computer a lot, maybe audiophiles, who really will experiment. But what are binaural beats? How do they help? How do they help you, at least?
Exactly. I think there's two very cool studies to talk about here. Yes. Taking a step back, what are binaural beats? Yes. Binaural, two, as the name implies, is you expose the brain to two different frequencies through each ear.
Right. So this works best with headphones, is the caveat.
Yeah, you need headphones.
Yes, you do.
Yeah. So, for example, if you expose the left ear to 390 hertz and the right ear to 410 hertz, the difference is going to be 20. So the theory is that these two sound waves collide in the brain, travel down the cortex, and the brain sees the 20 hertz.
Right. And
certain frequencies seem to activate different parts of the brain and quite significantly improve cognition.
So just to step back for a second, this isn't something you're actually hearing in your ears. It's an illusory psychoacoustic phenomenon. The brain thinks it's hearing it.
Yeah.
And so there's this third tone that's heard, and you're about to get to the idea of basically brain entrainment.
Exactly. Exactly.
Tell us about that.
So it's a very fascinating concept. The more I read about it, I'll be honest, the more confused I get.
Yeah.
I don't think it kind of reminds me of studying quantum physics when I was in university. I don't know if anyone fully understands exactly what's happening in the brain with, synchronizing these oscillations and activating certain parts of the brain, and why some frequencies work and some actually seem to cause harm.
That's a very interesting side of this whole thing.
Yeah.
Yeah, the harm part.
Exactly. So I guess, like you said, a lot of computer programmers, university students, a lot of people have heard of binaural beats.
Right.
You walk by people in the library and they've got these YouTube videos up.
Yeah, there's some novelty to it. It's interesting.
It's cool. You listen to it and it's typically very kind of easy to listen to with different sounds.
I'm gonna play an example.
Yeah.
Right here.
Exactly. And so I wanted to look into it a little bit more because, not only did I, want to find ways to counteract a lot of the negative effects of sleep deprivation, I had to study a lot during my residency.
You're not just practicing as a doctor, you're studying during your residency.
Exactly.
Yes.
Board exams and working 100-hour weeks. I wanted to spend as much time with my family as possible, doing things I enjoyed. And, I think it just makes sense to want to look at the literature. How do you learn better?
Sure.
Right. And binaural beats takes 2 seconds to put on a pair of headphones and turn the sound on if it improves cognition.
Yeah.
And so I had heard a lot about binaural beats. I used certain YouTube channels, but I wanted to actually look at the primary evidence myself. And what I'll say is a lot of the YouTube channels, I don't know if that's actually what has been studied or what the sounds that are being played are exactly what's going to produce the effect that studies have shown.
Right.
So they're very easy to listen to. It passes the time, but the sounds that you hear on a typical YouTube video are not actually what was studied for binaural beats.
Right.
So there are 2 very fascinating studies for binaural beats. One is measuring long-term memory. So typically the practice of binaural beats is you want to listen to them before you start a task, kind of prime the brain, and then during. And it seems like the longer you listen, there actually seems to be more and more benefit. So they took 2 groups. They compared binaural beats, 20 hertz, to white noise, which is, I think, a very good control. A lot of people listen to white noise. There's a bit of cognitive benefit with that.
Yeah, it's kind of like the static on your TV, if anybody doesn't know what white noise is. Yeah.
Exactly, versus binaural beats. And they found that the group that listened to binaural beats for 15 minutes and then had to memorize a list of as many words as possible in 2 minutes afterwards remembered 30% more than the group that was listening to white noise. I think it was about a 10% absolute increase. So they remembered about 26% to maybe 36 or 40% of the words, which was pretty fascinating. And if you think about something that you just kind of slap on your ears and listen to while you're studying,
right,
a relative 30% increase in long-term memory is profound.
Yeah, especially for something that's not passing through your digestive system,
Exactly.
Neurotransmitters and that sort of thing. It's just a sound.
Yeah.
That's fascinating. It just got me thinking, because when you say white noise, as a father of 2 young children, you're thinking about, it's very common to play white noise to get children to fall asleep.
Yeah.
Now I'm wondering, what would it be like if you use binaural beats? Interesting thought.
Yeah.
Yeah. I doubt there've been studies on that, but I'll take a look.
Yeah. I'll have to dive into that too.
So brain entrainment. This is the idea that setting up a binaural beat of approximately 20 hertz is going to sort of get the brain to hit those same waves of the same frequency, right?
Yeah.
There are many different types of brain waves, but the ones that are usually targeted with binaural beats are beta and theta waves.
Yeah.
So you've got beta waves, which happen when your brain is active. Those are within 13 to 30 hertz. So 20 is right in the middle there.
Yeah.
That's why usually these studies choose 20. And theta waves are between 4 and 8 hertz. This happens when you're meditating, when you're about to fall asleep. So perhaps there might be an effect with getting you to relax.
Yeah.
So the idea is to play those sounds, listen to them, and try to get your brain to slide into that same window of brainwave and binaural beats.
Exactly.
This is not a new idea, by the way. This is so binaural beats were discovered in 1839 by Heinrich Wilhelm Dove. So it's an old idea, but the idea of brain entrainment goes back to about the 70s. So it's been around for a while. This isn't some crazy new, shamanic practice that's come up in the last 10 years or so. There's some history to this. So just wanted to preface by saying that.
Totally. No, that's really cool. I didn't know that. That's,
it's been around for a while. Now you can. So you were saying playing it first. Yeah, I think that's interesting, because anytime that I've ever done it, I go to do something, I put it on, and I just go with the flow right away, right?
Yeah,
that's interesting. I can tell you anecdotally that when I do it, I find that my focus locks in, and I wonder, and I'm sure these studies parse this out. Maybe you know the answer. Are the cognitive effects a byproduct of the beats themselves, or is it because you're focusing better? Does it really matter? It doesn't really matter at the end of the day if there's an effect.
Yeah, I don't think I can say based on the studies. That's a good question. Yeah, I guess for me, that's a good. I don't know.
It might be hard to parse out.
Yeah,
I'm not sure. But at the end of the day, you played with them and you found it helped
a lot. And again, I like to go by the studies, right?
Yes.
I like to follow the study protocols. So what I did is I created the exact binaural beats that were used in the study.
Right. And I'll link in the show notes to your YouTube page where you can find these binaural beats exact as they had them in the studies.
Exactly. Because to be honest, I'm a little skeptical of a lot of the YouTube pages that say it's binaural beats.
No doubt.
And if you listen, it's not the most comfortable sound initially.
It's awkward.
Yeah.
Yeah.
And it's supposed to be that way, right? Because it's, these are the high frequencies that they're using, not, they didn't study what these other pages are using. So I'd made them myself. I learned how to make it in one of these apps and noticed a lot of benefits. So posted it on X or Twitter, and a lot of people were interested in it. So did a bit more of a deep dive. And I found another very cool study where they took, I believe it was university students, and instead of long-term memory this time, they looked at attention. And they wanted to compare binaural beats to, of course, placebo. I don't think they listened to anything, but also people that practice mindfulness. And there's a lot of very good evidence that practicing mindfulness, meditation significantly improves attention. It can even improve test scores. And what they did is they had a group listen to binaural beats and then do an attention test 5 times in a row. They wanted to exhaust them to see how much their attention would drop. And it was the go no go test.
Right.
So essentially, you tap when you see an object that you're supposed to tap, but you don't tap when it doesn't come up. But it goes pretty fast and it changes a lot. So you have to be really focused, right, to tap at the right time and not tap when the wrong object comes in. Right. So you'll need a lot of inhibition. So they exhausted these people. The people who were experienced in mindfulness, who had been doing a month of meditation, scored about 75% the first round, and it dropped to maybe 60%, right? The people who were in the control group got about 50% right at the beginning. After exhaustion, they were only 20%.
That's a big drop.
It's a huge drop. Huge. Just adding binaural beats, right? Something very easy to put on your ears. Takes no time. The group went from, again, about 50% before starting, and they increased to about 54% at the end of the task. So not only did they not drop 30%, they actually improved a little bit despite this exhausting task that they were doing beforehand.
Which is an effect that you never see.
Yeah.
Like not just dropping, but improving when you've got some sort of stressor. That's amazing.
Exactly. So all this together, again, risks and benefits. Like there's not much of it, sometimes maybe I'll get an occasional headache with binaural beats, but then you just take them off.
Right.
These are small studies. We're not going to get a ton of funding because there's not a lot of money in binaural beats, but these effect sizes are massive, right? So to me, it just only makes sense to want to do something very low risk that seems to have a lot of substantial cognitive benefit.
So I'm going to also link in the show notes, and I'll put it up on the screen, a website where you can make your own and sort of turn off the 2 carrier tones to see what that produces in terms of a binaural beat. It's very, very cool little experiment you can run to see what it is exactly that we're talking about. Wear headphones, turn on one tone, turn it off, turn on the other, turn it off, then put them on at the same time. And you'll see exactly what we're describing here. It's hard to imagine until you actually experiment with it. All these things together, you're still implementing you're done your internal medicine residency.
Yeah.
Right. So you still have 26-hour shifts in your future.
A lot less.
Yeah,
I made some good lifestyle choices.
Yes, fantastic.
Yeah.
But which of these three, if any, or all three, are you going to be keeping up with?
Yeah, that's a good question. I'm going to definitely continue creatine, 10 grams a day. I think there's a lot of very interesting and supportive cognitive evidence proving cognition under not even just sleep deprivation, but when you exhaust yourself and going to the gym regularly. Binaural beats, definitely use them almost every day. I've noticed a lot of significant benefit. And again, there's pretty much no risk to using them that I'm aware of, at least. Nicotine, I have a healthy respect for it, is what I'll say. I've been using it less because I haven't been as sleep deprived. I'm still using it maybe one time a week, but it's not at the point where I think taking regular nicotine is going to lead to any significant long-term benefits. It's more of a, keep it in the back pocket. But, I'm a very, athletic person in general. And I think exercise is probably the best thing to be doing.
Yeah, which is, we haven't talked about that yet.
Yeah.
So how did you modify your exercise routine? How did you find time, first of all, 26-hour shifts? How did you find time to exercise? What sort of exercise did you find helped the most in terms of peak performance while being sleep deprived?
Yeah, that's a good question. And I experimented with that a lot. Because coming from Thunder Bay, I was always outside, always hiking, golfing, going for runs, and being active was really, and being in nature was a really important part of my life. So I experimented a lot, just to walk you through a week briefly.
Sure.
Let's say Monday, Friday, Sunday, I'm doing 26-hour shifts. It's not a very uncommon week. And in between then, you get the next day off after sleep, at Monday, I work 26 hours, I get Tuesday off, but then you're back on Wednesday. So looking at a lot of studies, literature, the more you exercise, the more you have a buffer against the negative effects of sleep deprivation. And you don't need to work out that exact day for a lot of the benefits. We know sleep deprivation causes insulin resistance. It makes your glucose spikes higher, causes all sorts of metabolic derangements, impairs immune system, causes vascular dysfunction. It might even lead to, cardiovascular disease for chronic sleep deprivation. But by and large, most of the evidence is for aerobic exercise. So what I would usually do is my shift starts at 8 a.m. I'd wake up, go for a run, do my shift, sleep for a few hours, and then to kind of preserve my circadian rhythm, you want to reset it for that day, would go outside and get as much sunlight as I possibly could and probably go for another run that day. So I would spend probably as much time as I could outside because I was stuck in the hospital the rest of the time. There's a lot of benefits to that.
Sure.
And also tried to squeeze in about 2 days full body resistance exercise just to keep up muscle mass. Everyone should be doing resistance exercise. So the protocols I kind of developed was, trying to get my VO2 max as high as possible, exercising as much as I could. It would suck waking up at 5 to right before a 26-hour shift. And then I'm awake for, 32 hours. Yeah. But I found that the days I exercised, I performed better at work. I felt better the next day. And then I just had to drag myself out of bed after not sleeping and do more. And we have a lot of good evidence that it seems to reverse a lot of the negative effects of sleep deprivation. And a common question a lot of people ask, right, is should I sleep in and try to get my full 8-9 hours of sleep?
Yes.
Or should I wake up and get 6 hours or 7 hours and exercise?
Right.
And
both seem great. I mean, one seems better than the other, but
yeah. And it's very challenging to answer. There's a little bit of evidence that the more exercise you do, the more protected you are from sleep deprivation. So there is no replacement for sleep deprivation. What I did throughout my residency, it was a great experience. I was so happy and privileged to be helping people and learning so much throughout it. But it was very terrible for my health. But the best thing I could have done based on all the literature is keep exercising. That's exactly what I tried to do, is just be as active and outside as much as possible.
In terms of sleep deprivation and some of the protocols we've talked about here, What about sleep apnea? Any of this creatine or nicotine talk, any evidence or studies that have looked at sleep apnea as a source of sleep deprivation?
That's a good question. I'm not aware of any evidence. I would say sleep apnea we know is highly prevalent. A lot of people have it and don't know, and it's horrible for you, right? You're essentially starving for oxygen all night. Anytime you want to get into deep sleep and have your muscles relax, airways closing, and your oxygen saturation is plummeting, it's associated with pretty much any chronic disease you can possibly imagine.
Thinking back to what you mentioned about the oxygen deprivation study.
Yeah.
Right. So it's
that's a good question. I would say though we have pretty good treatments for sleep apnea though.
Right. Pretty straightforward.
CPAP it's had a bad rap for a lot of years because of people not being able to tolerate it that well.
Right.
But now, with the machines and equipment that we have now, people are able to tolerate it a lot better. There are some devices that people can use. So I would say if you have sleep apnea, you have to treat the underlying cause. But it would be interesting to look at. Actually, I don't think it would be ethical to look at creatine in this population because we know that sleep apnea is so detrimental, and we have such good treatments for it. I don't think we can. Yeah.
It's interesting. So, what is what's of interest to you right now in terms of what do you deep dive, because you're constantly deep diving coming up with these evidence-based protocols. What is interesting you right now?
That's a good question.
Because I know you're fascinated with chronobiology and circadian rhythm. What is circadian rhythm? What is chronobiology?
Yeah, that's a good question. That's definitely a growing interest of mine, especially with a lot of recent just medical literature too. Chronobiology, it's the study of circadian rhythms and biological organisms, of course. So virtually every single cell in the human body follows a pattern, a rhythm. Most follow a 24-hour rhythm. And I think one of the really cool things about circadian biology is a lot of people can understand it quite quickly because they know how it feels.
Yeah.
Right. So a lot of people know that you wake up in the morning, and when you wake up with the sun, ideally, you get a nice big peak in your cortisol. That's a stress hormone. Too much cortisol is bad. Too little cortisol is bad. But if you get a nice peak in the morning, it wakes you up, increases your blood pressure. It gets you ready and primed to do great things during the day. And people know what that feels like because most people have been jet lagged.
Sure.
And they know what, you're flipping your clock and all of a sudden you're wide awake when you should be sleeping. And then later in the day, your melatonin should rise nicely. You get sleepy. Ideally, you're not looking at blue light.
Right.
And fall asleep. And if you follow that consistent sleep schedule, you feel great, right? But you stay out really late on a weekend, you sleep in several hours, you're going to feel sluggish. It's going to be a bit harder to fall asleep the next night. And so that's just in general, circadian rhythms for how people, I think, can understand it briefly. There's a lot of cool literature about circadian biology and leveraging it to improve health and outcomes. So with these rhythms in the body, you can take advantage of these to improve health. And one thing that Dr. Sachin Panda, who's a big intermittent fasting and circadian biology researcher, brought attention to is that circadian aligned eating leads to substantial health benefits.
Oh, interesting.
He was one of the pioneers of intermittent fasting. And so when you think about how the body is primed for taking in food during the day, metabolism tends to be higher during the morning and afternoon, and it dips off in the evening. And we have some very fascinating studies showing that if you have people eat the majority of their calories in the morning and avoid eating at night, they will have better metabolic profiles. They'll lose significantly more weight. They'll be less hungry, and they will sleep better. And that's because this is just how the body is set up. It's every time you eat at night, you're potentially driving energy away from other processes that should be allowing you to fall asleep more easily, to focus on repairing and rebuilding. And we're learning a lot about circadian aligned eating and a lot of other, really fascinating literature as well.
That's very personally, I find that of interest because I've been intermittently fasting for 20 years now as a diabetic, type 1 diabetic. The battle with diabetes is to avoid peaks and valleys in your blood sugar. So I have found over the years that I eat one meal a day, but I eat it at night. I wake up, I don't have breakfast because I don't want to start that roller coaster of peaks and valleys. So I understand that the physiology and the metabolism of diabetes is very different from somebody who's not diabetic. So forgive me for being selfish here, having you here talking about this. But now you got me thinking is maybe I should flip that just to take advantage of that circadian or the, what did you call the alignment of eating with?
Circadian aligned eating.
Circadian aligned eating. Maybe I should be eating in the morning and not, I'll have one meal. Usually I have one meal at night. That's it. Maybe that should be closer to the morning.
It might be interesting to experiment. There's one study where there's a lot of cool studies where they just flip people's eating schedules.
Right.
So especially shift workers are a really great population to study this in. I believe they took two separate groups. One was eating during the day. One they totally flipped and ate only at night. And I believe their morning blood sugar spike was about 30% higher.
Eating at night.
Yeah.
Which makes sense. I mean, 8 hours later, you're still digesting, and I'm going to experiment with this.
Yeah.
You set off a light bulb in my head.
Yeah. Let me know how it goes.
Yeah, that's fascinating. Yeah. Do you intermittent fast? How many meals a day do you eat?
I'll eat probably as much as I possibly can before 2 or 3. Mm-hmm. So, I wake up early, I go for a run, I have as big a breakfast as I can, and then I'll pack a lunch and a smoothie. And I try to finish as early as I possibly can.
No meals, no dinner or supper per se.
No dinner. It's not great for the social life. You have to live sometimes. It's fine. It's totally fine to, cheat here and there. But in general, if I'm not going out with friends or anything, I try to finish eating as early as I possibly can.
Interesting. Is there, so chronobiology, circadian rhythm, an interesting article. I think it may have been a story, not an academic article, or was it a journal? Anyway, you posted something the other day about even the blind, can sense light, not through cones and rods, but through, you'll have to remind me,
melanopsin.
Yeah. So that just goes to show how important chronobiology is even to the blind. They have the ability to sense the time of day in terms of light. It was a very interesting article. I had no idea.
And these melanopsin receptors are very fascinating. I guess maybe I should talk a little bit about night owls and morning larks.
Yeah, please do.
This is something that's been very fascinating to me because I'm naturally a night owl.
Likewise.
All through university, up until 2 a.m., we're doing assignments. Waking up for 8 a.m. classes was the most painful experience ever. Mm-hmm. And it wasn't until probably medical school, just kind of reading about things, talking to other people, I wanted to kind of try something else out and see how waking up earlier would go. And it was a painful, horrible process. It was really hard. Yeah. And the interesting thing is that it actually, I think I did it all wrong because I just tried to wake up early and then just do my own thing. I didn't follow any, advice. And I guess you might ask, why would you want to switch from a night owl to a morning person? Or are we destined to be night owls? Right. And there was actually a beautiful study in Colorado about this. So the question was, a lot of people say, and there's a lot of evidence that night owls it's a genetic thing, right? So they took night owls and they got them to go camping. No devices, campfire at night. And they phase shifted substantially in just 3-4 days. They truly shifted their melatonin 2 hours earlier.
So they were outside the whole time?
They were outside the whole time. They were camping, they were hiking, getting bright morning sunlight. And they went to bed 2 hours earlier. They slept 2 hours longer. They woke up at the same time typically. But their melatonin, if you looked at it, actually shifted 2 hours before. They started to become morning people in just 5 days.
Interesting.
And
were they instructed to go to bed earlier?
I think it was whenever they wanted. Just do your own thing.
Interesting.
And I guess you might ask, like, why would you want to become a morning person from a night owl? Because when you look at cohorts of people, night owls in general do a lot worse than morning people. College students, night owls perform worse on tests, which makes sense, right? You're usually up until 2 a.m. Your sleepiest time is when you're writing your exams in the morning, usually. Yeah. Higher incidence of chronic diseases, worse immune systems. And so there was one beautiful trial about, let's just try to give people a couple instructions to see if they can switch from night owl to morning person and if that makes any difference. So they randomized 2 groups of people. And these were all night owls, confirmed with their melatonin rising late at night. And they just gave them practical advice I should have taken myself when I tried to become a morning person. Get bright morning sunlight. If you can't get sunlight, if you're waking up too early, you live in Canada, I have those bright light therapy lamps, 10,000 lux. So it's going to be painful, but wake up 2-3 hours early, get bright light, whether it's the sun or that lamp. Avoid light at night. Blue light at night is poison to our circadian.
So we're talking about devices.
Exactly. Yeah. Devices are the TVs, pretty much anything like that. Avoid eating at night because we know eating at night can shift the circadian rhythm, impair sleep. And these people, within a matter of, I want to say 3 weeks, shifted 2 hours. They became more morning people. Just with some very general guidelines, right? And they also looked at, what improvements were there. The people that were night owls, that they all shifted towards being morning people. They had lower depressive symptom scores. They had lower stress scores. They had higher cognitive scores at 8 a.m. in the morning. They were stronger. They measured their grip strength in the morning and afternoon, and their grip strength went up.
That's fascinating.
And so, just 3 weeks of basic principles of getting light in the morning, avoiding light at night. This group significantly improved their overall well-being. And of course, there are going to be outliers, and it's going to be hard for some people. But I really encourage people to try to live with our natural circadian rhythms, getting as we used to, as we were born to.
That study with the camping, that's really interesting because I've experienced that myself going on 4 or 5 week long day camping trips. It's very quick how quickly you I'm a night owl like you are. That goes away. You might be hiking, walking, portaging, that sort of thing, as we do in Northern Ontario. And you look at the clock, it's 8 p.m., it's dark and you're tired. You've been walking all day perhaps, but that shifts very quickly and it's very refreshing. And then you're up with the sun, which as a night owl, you're not.
Exactly. Usually, right? Exactly.
And that's fascinating. So I think there's a lot there to be, to take away for students, especially with, performing a little bit better on cognitive tests in the morning, right? If you need to write an exam, try to shift yourself a few weeks before. Right.
I should also say the mechanism, why did these people shift so much is they actually looked at how much light exposure they were getting from the sun. Right. They were spending all day outside compared to inside. People will, a common day for a lot of people is waking up inside a dimly lit home, going straight to an office. Right. These people are getting an average of, I think, 500 lux, which is not much, but it's a typical office setting. And then during this...
Sorry to cut you off, but lux is a measurement of what?
Of light.
Of brightness?
Brightness.
Okay.
Yeah.
Gotcha.
I believe. Yeah. Right. So, not getting much light exposure throughout the day, but the massively bright amount of sun during the day is probably what helped shift these people to being early morning people. And the other fascinating thing is we know that a lot of things make you more sensitive to bright light at night devices. And the more sunlight you get during the day, the less sensitive you are to devices and blue light disturbances at night.
So you sort of, so you don't build up a tolerance, but you're almost allowed to use your device.
You kind of buffer against it.
You earn it.
Yeah. So that's why it's really it's quite detrimental, and why probably a lot of people have trouble sleeping when they're in an office all day. They don't get any sunlight. They go home, they're looking at a device that's brighter than their office settings.
Effects here. Yeah,
exactly.
That's interesting. And presumably some of this has to do with vitamin D production as well.
Potentially, vitamin D deficiency can make people feel quite terrible, especially in Canada. A lot of people are deficient. That could certainly play a role.
Okay, so tapping into your experience, what is the greatest advice, or what advice would you give to students, whether they're medical students, engineering students, any type of student in the throes of studying, exam season, being stressed out? What is your advice to these students to optimize their performance? What are the key takeaways?
It's a good question. I would say the most important thing is to prepare beforehand, so you don't have to cram, because that is probably the worst experience ever.
Counterproductive, yeah.
And you get more stressed, and we know that too much stress can impair performance. I would say it's important to take care of yourself at the same time. And we know that, the more you exercise, the healthier you eat, the better you feel, and the better you're going to perform throughout all of this. So I would say it's really important for students, everyone, please focus on your own health. It's really hard to get overwhelmed with the day-to-day, struggles of, university, high school, medical school. But if you force yourself to make time to be healthy, to exercise, if you meal prep, it will pay off. It might feel like you're wasting time initially, but it actually pays off in the long run. So I'd say prioritize your health. That's the most important asset that you have. Additionally, plan ahead, have study plans. I would say with respect to studying strategies, one thing I found, and there's actually some cool evidence for, is testing yourself. Even if you don't check the answers, testing yourself substantially improves retention.
Yes.
So that's something, I guess I've kind of become a professional studier throughout all of university and med
that's
school.
Essentially what you become at the end of the day. Yeah,
exactly. So I always, I love test banks. AI is phenomenal for this.
I was just going to say.
Yeah, you can get ChatGPT to create a beautiful quiz out of anything in minutes.
Yep.
Right. So I would say always test yourself. And then after you have that strong foundation, the other things, it's kind of like the cherry on top. Right? Creatine probably helps. Binaural beats, I definitely do. Sleeping, do not sacrifice sleep for studying.
Sure.
That's one of the worst things you can do.
I would agree. And I followed that rule when I was studying as well.
Yeah.
You cut it off at a certain hour, because anything after that hour becomes counterproductive.
Exactly. And, I was recently writing my final board exams for internal medicine, and, there's millions of things to memorize, and it's really easy to want to get overwhelmed and, memorize a few things really quickly the night before. And that's what I used to do in university when I was up until 2 a.m.
Right.
But, there's actually evidence that if you sleep, you consolidate more knowledge. It might not feel like it, but getting a good sleep the night before an exam is probably the most important thing you can do.
You mentioned testing, anecdotally, I have found that as well. Now, I wonder if you've experienced this before. You walk into an exam, there's some doubt, you have some anxiety. I don't know this, I don't know that. You write the exam, you finish the exam, and you walk out feeling like you know everything, simply because you wrote the exam without even seeing the answers. There's this thing that I find happens where it's, the stress, and it might be a metabolic thing, sort of leaves you. And as you leave the exam hall, you feel like you know everything. So I think that testing in advance and sort of putting yourself in that same situation might relieve some of that stress.
That's a fantastic point.
You know that feeling?
Mock exams. Yeah. No, that's the best thing you can possibly do too. Yeah.
Right. Fantastic. Well, Brandon, this was very enlightening. I will continue to follow your X page with great interest. You've got a lot to offer. The fact that you do evidence-based protocols, I think that's what's missing in a lot of the sort of bro science that's out there, or I don't want to say pseudoscience, but even the stuff that's, a little too heady, breaking it down the way you do on X is fantastic. I encourage everybody to check it out. It's a great follow.
Thank you.
Thank you for joining me.
Thanks for having me.